City Area Medical Center. I'm Melinda. You guys can come on in. So, this is our waiting area. So when our patients come in, they can have a seat over here or over here. And then over here is our Wellness and Education Center.
What goes on in there?
All kinds of things. On a weekly basis, we have Zumba and yoga and physical therapy in the summertime. So, but it's a big, nice room. And anybody can reserve it. There's all kinds of organizations that use it. EMS uses it a lot. So here is our patient registration, where patients would register and check in. And I'm usually sitting back here. So if you want to come around here, I'll show you the other side of the office.
Hi, I'm Bob Downs. I'm a physician assistant here at Lake City Area Medical Center. I'll show you around our clinic, let you see what we have here. This is our nursing station, where most of the work gets done, actually, for our patients and in support of our patients. When a patient comes in from our waiting room, they usually come through, we get a weight and a height before we bring them into an exam room, where we'll vitalize them, getting a blood pressure, pulse oximetry, and then all of our exam instruments are here for anything we might need in terms of taking care of them while they're here for their exam. In addition to our 4 exam rooms, we have a small dispensary pharmacy because we are in a remote location, so it's nice to be able to provide some initial medications for patients that they might need. And then this is our trauma area. We are some distance from significant hospital care, so we do have some fairly serious and sick patients that are brought in, and oftentimes through what we call our ambulance entrance into our trauma area, where we can care for them here, taking care of larger wounds and that sort of thing here. EKG monitoring setup, as well as doing the same sort of things we could in the exam room here as well. And then here we have our laboratory, which we're able to do some basic lab tests, CBC, basic metabolic panels, chemistries, urine for urinalysis and such.
My name is Dr. Bruce Uchida. I'm the director of the dental clinic here in Lake City at the medical center. I'm going to show you around and show you the dental clinic and what we've got here. We've got 2 operatories. We have equipment here to do a lot of dental procedures that you'd usually have to send out to specialists since there's no specialists within 50 miles of here. We do a lot of it ourselves. So
during the summer, there's a much older population, basically a retirement community, because these are the folks that can afford to be here and spend 6 months of the year here seasonally and spend the whole season with us, basically, I guess is a better way of putting it. So it is an older population, an aging population. And as I said, they bring their ongoing, more chronic disease processes with them, which we are in a position to have to manage while they're here, which makes it kind of challenging, but interesting at the same time.
We almost have 2 seasons. We have an urgent care season of June through September, and then we have a preventive care season that is almost the rest of the year.
I don't have the conveniences of having specialists around, so if there are needs, I'm doing a bigger scope of practicing here. I'm not just doing restorative dentistry or preventative dentistry. I'm doing a lot of more specialized dentistry.
This is a challenging life. I mean, it's actually intellectually, professionally, a challenging life, and it is.
Is it worth it?
It is worth it. Yeah, I make half the money I made in 1985, and I think it's telling when you work as hard, if not harder, make half the money, and you don't regret it. That's actually pretty telling.
What do you think?
If you did a needs assessment, we would be okay. If you did a sustainability assessment, it gets weak.
Yeah.
And that is sort of devastating to us. And that's what really impresses me about Lake City, is that they have taken that task on themselves. You know, the world we have lived in is that if you can make enough money, then you can have a practice in that location. Well, here, it's almost impossible. It doesn't mean that the work is not needed. It doesn't mean that the function is not needed. It just means it's not economically viable without outside support.
The value of the clinic can't be overstated. I'll just say that right now. Dr. Derman and his staff are very experienced, very capable. They care about folks. The clinic is something that gives us comfort in the winter because we know we can have access to medical care when we cannot sometimes drive to Gunnison. If it's in the middle of the night and it's a blizzard, the road is not passable sometimes.
You will hear people say, I would never come and live here. I would never come and visit for 3 or 4 months out of the summer if there wasn't medical care. And that's consistent. I mean, the average age in the town, I think, is like 56, 57. And we have a lot of early retirees and stuff. And so we need, we need medical care. And so, I mean, without it, I know that there would not be a lot of people here.